So, you all are here to take another attempt at FMG in June, which will supposedly be one of the last FMGs, because after that it will be replaced with next. So it is all the more crucial that you tackle this one really hard and you ace this exam. Now, whatever happened, happened. Maybe you studied well, but you could not perform in the exam. It was your first major exam. There was anxiety, or maybe there was lack of knowledge. That's why you failed. Maybe it was just pure luck. The questions came from the part which you had skipped. Always happens, right? So we will tackle all of those. The first point I would like to tell you all is to take a mock exam. I know this sounds like what we just took the actual exam. Why should we take a mock exam right now? But to assess where you all are at, you need to take a mock exam to see how far you are from your goal. Now you would say, we know how far we are, right? We got 148 or 149 or 130. We know we are just by like 5 points or 10 points. But if you take a mock exam, you'll also get an analysis of where you're lacking. For example, you took a mock exam and you see that most of, like, you have literally scored only 1 mark in microbiology, and out of 10 questions, let's say, or 5 questions. So you clearly see that I can improve this. If in exam I can get 4 out of 5 correct instead of 1 out of 5, that is like I'm gaining 3 more marks. Whereas if you see in your mock exam that your radiology questions are 6 out of 6, then you need not focus on radiology. Studying for radiology now will not help you much, but studying for microbiology now will actually help you a lot. It can increase your score. So that's why you need to take a mock exam. And the purpose of this is analysis. You need to analyze yourself, how, in which subjects you're lacking, in which systems you're lacking, and that's how you will proceed from there. Now is not the time to, okay, let's open the book, start from chapter 1, anatomy, physiology, and again reread everything in these 6 months. It's not the time right now. That time is gone. It's not like you guys don't know anything. You guys know something. You have taken the exam. You have reached a certain level. Maybe it's 110, 120, 90, 80, 149. I don't care. But you know something, right? There is a base. And we need to build up on that, not start from scratch, because it will just take up most of your time. So you have to take a mock exam and do your analysis, which subject is lacking, which subject can I most improve in. You have to do that one first. And so on and so forth. You will keep on tackling subjects like that. If you want, take one more mock exam, take 2 mock exams, and see your cumulative analysis and see, like, okay, my immunology or microbiology was weak. I should focus more on that. It's not like, microbiology does not have many marks in the exam, so I should not focus on that. No, maybe if you focus even on those 2 3 marks, that will increase, because you don't know that. So first point is clear: take a mock exam or two, analyze yourself, analyze which subject is you can improve most in, and do that one first. Now the next point is the base. How is your base? The base means the 3 P's. P. Your physiology, your pathology, and your pharmacology. Now, trust me when I say this, most of the questions you're going to answer in the exam can somehow be backtracked to physiology or pathology or pharmacology. I'll give you an example. I myself did not study exclusively for this exam. I just improved my base of physiology, pathology, and pharmacology. I was studying for USMLE. So I just told myself, okay, there is not much overlap between USMLE and FMG, but the base is same. If I complete my physiopath farm, it will help me immensely in FMG as well, and obviously it will help me in USMLE. And that's what I did. Uh, I focused on my base physiopath farm, and I could answer most of the questions. Like the questions I didn't know were like I have never seen because I did not study some subjects. But most of the questions I could answer because of a good base of physiology, pathology, and pharmacology. And you need to integrate it. It will be better to study it system wise. For example, you study respiratory systems, you study physiology of respiratory system, then pathology, and then pharmacology, rather than you study the whole physiology and the whole pathology and the whole pharmacology. It's better you do system wise, because I'll tell you an example what happens in the first part in physiology. For example, let's take an example of respiratory system only. You will know what receptors are, let's say, present on the bronchioles. You know there is beta 2 receptor on the bronchioles. You know how the respiratory system works. There is inspiration, expiration, lungs, like the diaphragm flattens on inspiration, the lungs expand on inspiration, and everything. You know everything. In pathology, you will know what is abnormal in this process, what is happening wrong in this process. For example, let's take one of the most common diseases we have, like asthma. You will know asthma is because of bronchoconstriction and inflammation. So you know all about the bronchioles, all about the respiratory system from physiology. Now you will learn or build up on it with what happens if there is bronchoconstriction and what is inflammation. That is pathology, right? So you will know what are the signs and symptoms of asthma because there is bronchoconstriction and inflammation. Now that you've studied pathology, next comes pharmacology. Now, since you know that the pathology is related to bronchoconstriction, you will know what pharmacological agent to give. Okay, simple. There is bronchoconstriction. So, how can we dilate the bronchioles? Oh, I know from physiology that there are beta 2 receptors. So, let me give beta 2 agonists like albuterol, short acting beta 2 agonists. Let me give albuterol. And that's how this is one of the treatments for asthma. Oh, but you also mentioned there is inflammation. So what can I give from inflammation? Maybe I can give a glucocorticoid, to reduce the inflammation. That's also one of the treatments for asthma. So if you know the physiology and pathology and pharmacology, you can integrate it really well. But if you study them separately, you tend to forget some parts and the integration is not very strong. So if you had not done this previously, I would highly recommend to do it system wise. You do this system wise, and you will see that how much you can improve on this. So physiology, pathology, and pharmacology, you have to do like this. Now, obviously, some subjects will not have this physiopath farm. For example, if you're studying biochemistry, you will say there is no physiopath farm in biochemistry. In that, you have to focus on your important topics. What is important in biochemistry? The easy scoring points in biochemistry are vitamins. You have to know your vitamins. Vitamin A deficiency, excess. B1 deficiency, excess. B12 deficiency, excess. How to differentiate between B12 and folate deficiency. Like, there are some common questions which you should know. And these are easy points. For example, if you study metabolism, it's a difficult topic. You need to know all the cycle, Krebs, glycolysis, HMP shunt, etc., etc., etc. But vitamins are equally scoring, but they are easier. So if you're less on time, focus more on vitamins. Like you can score more easily. So also you have to focus on high yield topics. okay, system wise and high yield topics after you build the base for the subjects. How can you find the high yield topics? By doing more and more questions. When you do questions, you will know, okay, there is always they ask a question about B12 and folate, B12 and folate. In my own FMG, I got 3 questions on B12 deficiency. They always are. It's like their favorite topic. So if you're not doing that, that means you're losing out on marks. So maybe this attempt you were not aware what are the high yield topics. Maybe this attempt you were like, let me study everything. And in the end, it was too much to revise and all. And that's why maybe you got a low score. This could be one of the reasons, right? So let's tackle that reason. Focus on high yield topics. This is a screening exam. I'm in no way telling you don't get 200, but it is a screening exam and you have to realize these marks do not matter. With these new rule changes, they might matter in internship with how they are changing, like how they are giving away internships according to mass. It's very recent rule. We still don't know how you will be getting internship after FMG. Earlier, we used to go hospital to hospital and ask for internship, but that's not the case right now. So this is about the screening exam. So you want to make sure minimum you get 50%, 150. Hardly matters if a person has 200 or 150 or 280 or 150. Both are equal, both are pass. Both have the license to practice in India post internship. Doesn't really matter. No one's going to ask your FMG marks. No one cares. So don't put that much pressure on it. Okay, it's a screening exam. Take it as a screening exam. So let's not like drive way too much away from our topic. This was about the base. You need to build your base. Number 3 is how to revise. Okay, why does this keep happening? I don't want to type. Yeah, how to revise. I'm sure you have realized by now that how important revision is. If you study something today, it's very important that you remember it during the exam. And the only way that is possible is if you keep on revising it until your exam. That's how it is possible. Okay. So what you need to do is focus on revisions more than studying new topics. You will only study the high yield topics. You will only focus on your weakest subjects and move up from that. And third is how to revise. So most people are like rereading the subjects, rereading the book. It sounds good. It sounds easy. It works, but it is not the most effective. I have done it. You have done it. Everyone has done reading as a means of revision. Just modify it a bit. I'm not saying completely abandon it. Just modify it a bit. If you're reading from your notes, open your book, but just close the main topic and just look at the heading before reading. You will read it afterwards. Just close the main stuff and just read the heading. Okay, asthma, and you're studying pathology. So just in your mind, okay, what is asthma? What must be written here, which I'm hiding? There is something written, right? You just want to guess what is written. Just play a game with yourself. What must be written here, which I am hiding? And okay, you say, okay, asthma is bronchoconstriction, inflammation, etc., 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 and then you remove your hand and you read. And then you see, okay, how much did you get correct and how much did you get wrong? There will be some information which you missed. Okay, there'll be some information which you missed. So what you have to do about it is underline only that information. Don't end up underlining everything. Just underline that information which you forgot. That means you were weak in that thing. You did not know that thing. It will be personalized and catered towards your preparation. So only underline the parts which you did not know. The next time you read your book, just close that underlined part and think, what was it? And then you will see you are working on your weaknesses. You always knew asthma has bronchoconstriction and inflammation. That was not the problem. But maybe you did not know something else about asthma. Maybe you did not know the FeV1 FVC ratio decrease in obstructive diseases. Maybe that was the thing you did not understand. You need to tackle that. No need to waste your time in re-revising the things you already know. Of course, that's amazing to do, because you will help, you will retain the knowledge more, but here you need to focus on your weaknesses. You're not a newbie now. You have studied it. If you were a newbie, yes, study everything, revise everything, but now you need to focus on your weaknesses. So this is called active recall, that you are hiding something and thinking about it and then seeing the answer. There are more methods of active recall: explaining to a friend, or explaining to yourself, or something, doing questions, or making mind maps from your own knowledge. All of this is active recall. I have a video on my YouTube channel about active recall. You can see that and know more ways of active recall. But in general, the easiest active recall, I would say, is just closing the book and and memorizing, and then rereading how much you got correct. Underline your weaknesses. Next time, tackle those weaknesses. That's it. That's how you move on. And you have to do spaced repetition. And I know these are like big, very buzzwords: active recall, spaced repetition, active recall, spaced repetition. Everyone's talking about this. It's basically, you just do this time to time. For example, if you revise today, then after 1 week, then after 10 days, then after 20 days, then after 35 days, you can have your own schedule according to your own needs. uh, for example, microbiology, you might need more spaced repetitions than, let's say, something like radiology, because some topics are memorization heavy. There is not a single formula that, okay, revise 1 day, then 1 week, then 10 days. It might work, but all subjects are different, I would say. I definitely think microbiology needs more spaced repetition, for example, and medicine maybe does not, because it's more conceptual, it's thinking. You need to narrow down the concepts which you can retain better, rather than something which is memorization heavy. So third point we have is revision. Fourth is, you have to take breaks. So a general rule to follow, I would say, is the easiest, which I have followed almost all my life, which I have studied, is you have Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, and Sunday, right? 7 days in the week. How do you want to divide these 7 days according to your studies? For me, again, it can be personalized. For me, my friends or my social life always was on weekends, let's say Saturday or Sunday. So I would have always wanted to take a break on Saturday, Sunday, so I can enjoy with my friends. I can have a blast, or I can just relax. So I made sure that Monday to Friday I am studying, and Saturday, Sunday, one day I wanted to take break, and that was not up to me. Maybe my friends and we plan to meet on a Sunday, maybe we plan to meet on a Saturday. It was one of this. If you're trying to say something, I can't hear you. I'm not sure. You muted. Yeah, so anyway, Monday, Tuesday, Wednesday, Thursday, Friday I studied, and one of the Saturday or Sunday I took a break. What about the other one? Other one, I studied like half a day. I tried my best and relaxed. So breaks are important. Now you may say that, this sounds like counterproductive. I'm actually, you're telling me to relax, but this helps, because if you do this, then you can attain some consistency. You cannot expect your body to study 10, 20, 30 days straight without a break. Your mind needs a break. So in general, you can just divide it by the week, 5 to 6 days of studying, 1 day of break, and the next week rinse and repeat. You have 6 months, like I guess March, April, May, June, 4 months for the next attempt, right? That's almost 16 weeks. That means in 16 weeks, you will just have, I don't know, 16 to 20 breaks, 20 days breaks, which is absolutely fine if you are studying the rest of the days, if you look at it that way. So uh, you can you can follow this, and you can have this 1 day which as study or break, depending on how your body feels. For me, I studied so hard 5 days that I needed like 1.5 days break. I tried to study, but I needed it because I knew that these 5 days I'm going to crush it. I'm going to give it my all. And the break days, I'm also going to give it my all towards my break. I want to party hard. I want to chill with my friends. I want to do everything. I want to do everything to the limit, right? So study to the limit, party to the limit. So it works that way. You won't tire yourself. This was about breaks. And last, we'll talk about mock exams. This is very, very, very important, and most people underestimate this. Your last month, that means if you have 4 months, last month should just be mock exam, only mock exams. Why do I say this? Because see, FMG is actually not testing how much knowledge you have. It is testing how many questions you can answer. That's the base. Your medical career will eventually test how much knowledge you have as a doctor. There'll be patients with different variety. Your internship will check how much knowledge you have. But this exam is not really checking that. This exam is checking how many questions you can answer correctly. You can answer that by eliminating other choices. You can answer that by other test taking skills. You can answer that by, oh, I had done a question like that. Oh, my friend told me about this. Oh, this was a previous year question. It does not matter how you know the question as long as you get it correct. How would you get that? By giving mock exams. This is really, really, really important. Last month you need to give at least two mock exams every week. So for example, what I would recommend is uh, again, one mock exam on Monday and revise on Tuesday, Wednesday. Cool. One day you give your mock exam, 2 days you have to tackle the weaknesses. You revise what you got wrong, you learn from the explanations. Maybe you see that this topic I'm always getting it wrong. You reread that topic, you re-understand that topic, watch a video. You have 2 days to revise and only focus on the weakness of your mock exams. Second mock exam you're going to take on Thursday, and you're going to revise Friday, Saturday, and Sunday it will be break. Right? So in a week, you're taking two mock exams, one on Monday, one on Thursday, and you're revising on Tuesday, Wednesday, and also Friday, Saturday. You're doing this continuously for 4 weeks, right? Before the exam. That means you have done 8 mock exams before taking the actual test. If each mock exam you take is about 200 to 300 questions, that means you have successfully actually completed a whole question bank. If you look at it, 8 into 3, 8, 16, 24, that is, I don't know, 2,400 questions you are doing just in the last month. And mock exams usually have the high yield questions. So basically, you have completed 2,400 high yield questions all in the last month. That is essentially your revision. That is your revision. People are like, I want to revise this subject, this revise. No, this is your revision. In the last month, you should be focusing on the content which is most likely to appear in the exam. How will you find that? Mock exams, right? So if in the last month you give 8 mock exams, you will see your score will improve your first mock exam versus your eighth mock exam. You will see your eighth mock exam will most likely represent your actual FMG score. You will see that. This is how you will improve, and this is the part which most people do not do, because we are not taught that way. We are taught always study, 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 and in the end you revise everything, because it gives a sense of confidence. Okay, man, like I saw everything in the last go, I remember everything. But the real revision is you should have all the questions done um, before the real exam. So, lastly, I think we have done everything. We have discussed everything, your approach. If you need personal guidance on more than this, on how to structure your preparation, I'm always there. I have a session link which you can book. It's paid, but it's not like you need it mandatory. Of course, you can do it on your own. I did it on my own, so it's not necessary. But in just some cases, somewhere down the journey you have any doubts, and you need some of my time or my expertise, and I'm in no way like if you take this session you will guarantee pass. It's nothing like that. It's sometimes you need a mentor and you don't have one. I'll be there to help you, but this is the structure. Sorry, I can't hear you. Anyway, this is the structure I want you to follow. I'll try and upload this on YouTube so you can revisit this structure. I'll just summarize it. Take a mock exam, analyze yourself, which subjects are weak, which subjects are strong. Start with the weakest subject, end with the strongest subject, or even you don't have to study the strongest subject. You have to maintain it on the level of strongest. I don't know who's drawing these hearts. Don't do it. The base, focus on the base. Uh, Physiology, pathology, pharmacology. Most of the questions can be backtracked to these three subjects. Eventually, you will learn medicine this way. 3, revise. How to revise? Active recall, spaced repetition. The easiest way is by closing the topic, reading the heading, recalling what you know, underlining your weakest parts, and the next time tackling that. Number 4 is breaks. It's important to take breaks, study 5 to 6 days, take 1 to 2 days off, basically. 5th point, mock exams, really important. In the last month, this is essentially your high yield question bank. If you do this, you will see your score increase. It will give you a confidence, I'm sure. And how you want to do this: Monday, 1 mock exam, Tuesday, Wednesday, you revise the mock exam fully with the explanation, tackle your weaknesses, reread the topics which you are not good at you seeing from the mock exams. Thursday, take another mock exam, and you will see those topics which you were lacking in have improved. And again, focus, slowly your weaknesses will go get ticked, and you will increase your score. 2 mock exams in a week. There are 4 weeks before the exam, so you are essentially taking 8 mock exams, which are very, very, very important. And just in case you need personal guidance, I'll have a link. I'll put it in chat, and you can save this link, or you can just DM me and I'll send you the link, or it's somewhere on my Instagram. No need to worry about it. I'll be reachable on Instagram, and you can tackle everything. Now we have 3 minutes left. I'm sorry it took a little bit longer. If you have any questions, please do let me know. I'll try to answer. We have 3 minutes. Any questions?
So yeah, I have one question. Like as you said, mentioned in like point or second, that we have to build a base for all the three P's. So for me, it's like when I start doing system wise,
Hmm.
it gets really tough to finish in a very short duration for me. So for how long should I mm, make my timetable so that I finish all three subjects?
Okay, good
Like,
question.
yeah.
Good question. See, this is again, if I tell you, give 10 days for cardiology and 10 days for renal, it's probably not wise to tell you that, okay, give 10 days also for gastro. Gastro is relatively easier than cardio and renal. There
Right.
is no definite time frame I can give you. Also, time frame depends on actually how much time do you have. If you're 3 months away, you will do everything faster and the time duration will get shorter. If you're 1 year away, you can take your time. You can have like 20 days for one system. It is very personalized. Maybe you actually know cardio and you can finish it in 2 days, and you are weak in gastro, and that might take 7 days. You know how much time do you need, because you're not starting out new. If you're starting out
Right.
new, yes, you can have a general thing that, okay, microbiology might take long because it's memorization heavy. You can say radiology will not take long because it's not that big. You can say, but this is all if you're starting new. You have to focus on your weaknesses. The weaker the subject is, the more time it will require. I can just say that. And again, if you try to make your personal timetable, no need to follow a general timetable. You have to personalize your timetable according to your weaknesses. That's how I always say. So yeah,
Okay.
that will be your answer.
So there's one more question. I don't know if it sounds good or not, but I used to give my mock exams and I used to score like around 130 to between 130 to 140. And what I analyzed was that like only one or two subjects I got like strongest one, but the rest of them either I got need to focus or either I got you are the weakest in
Yeah,
that
yeah,
subject.
yeah, yeah.
So like
That's
maximum subjects I need to focus on. So
okay, then that's your
is
answer. Focus on those. That's literally what they're telling you. Don't focus on the subjects which you already know good. Just maintain the level of knowledge you have. Focus on the subjects which you need to focus on. Okay? And then you will see
okay.
most of the subjects will come like on like, okay, you have enough knowledge. And I think we have
Right.
less than a minute. So if you have any more
Yeah.
questions, you can DM me at Mad About Medicine. You can send me an email, comment on my YouTube, anything. You can reach me anywhere. Thank you so much for
Thank you.
being with me today, and I'll try to post this on YouTube as well to help others. If one of your friends is also there, you can share this with them and share my channel, and that